When Afghan-born Wahid Aryan came to the United Kingdom 2 decades ago at the age of 15, he was told he'd probably become a taxi driver or a restaurant worker. But the former refugee had other ambitions.
Having spent 15 years suffering from war in Afghanistan, hiding from the deadly rockets and the bombs and the shellings, and also having spent 3 years in a refugee camp suffering from malaria and tuberculosis, then that passion in me to become a doctor in the first place was instilled from an early age.
Aryan followed his passion and is now a practicing doctor at Liverpool's Aintree University Hospital. Using advances in video and web conferencing, Dr. Aryan established his own charity to use the same technology to help doctors and patients in his home country.
Dr. Najib, can you hear me okay?
Hello, doctor. Good evening.
Hi, it's Dr. John Curtis here.
We have a patient in here. He's a 22-year-old man. He was unconscious about 2 hours. And then after he wake up, he is complaining from the generalized body pain.
Using Skype or FaceTime, volunteer doctors are able to diagnose patients and advise local doctors in hard-to-reach areas such as war zones or low-income countries that have inadequate medical support.
In a country where there isn't quite as much infrastructure or support or expertise, you can make a massive difference with just a short period of work.
On the receiving end at Wazir Akbar Khan Hospital in central Kabul, Dr. Najib Surabi says telehealing is beneficial to both health providers and patients.
It's a very easy way to contact with them and to consult the patients through the telemedicine.
For Mazaruddin, the father of a patient at the hospital, telemedicine works.
It makes things easier for us to avoid traveling abroad, and it saves time.
Aryan says the service is now used in almost all of Afghanistan's 14 intensive care units. It's also used in the war-torn Syrian city of Aleppo and is being extended into some parts of Africa to bridge the gap between doctors and patients, even in the most isolated and hard-to-reach places. Mariama Diallo, VOA News.